Yeah, like in humans, they've been able to find a lot of kind of like markers and suggestions that there's a lot of functional and inflammatory changes going on in the gut even before anyone has clinical signs. And so it seems like dogs have that too, particularly it's been mainly just studied in this breed, soft-coated wheaten terriers. So I think the key is like, well, what can you do about that to prevent that from becoming, clinical disease?
Well, welcome to the Pet Food Science Podcast. I'm very pleased to be here today. I think you'll enjoy it. We're going to have an interesting discussion about GI disease and enteropathy. I've got two experts with me, which I'm excited to learn from, Dr. Grady and Dr. Tolbert. And I'd like them to introduce themselves and tell us how they got to where they are today and maybe a little bit of their background.
Sure. I'm Dr. Katie Tolbert. I'm an associate professor in the Texas A&M Gastrointestinal Laboratory, and I am both a small animal internist and a small animal nutritionist. I did the nutrition later in life, recognizing that nutrition was probably the key to the treatment of many of my patients with gastrointestinal disease.
And your current location is Texas A&M?
College Station, Texas A&M. That's correct.
Hey, Dr. Grady.
Awesome. I'm Dr. Kylie Grady. I'm a PhD student under Dr. Katie Tolbert. And so I'm also part of the gastrointestinal lab at Texas A&M. I am also a veterinarian and a board certified internist as well.
Excellent. Well, we're going to talk today about, I think, an area that's pretty fluxing. There's lots of changes going on. Why don't you just tell us a little bit about how we've got to the place we are today with this really critical component of health in pets?
Sure. Yeah. So I can start, and then probably Dr. Grady can add to it. So we were talking about the fact that, Dr. Grady and I are often presented with dogs and cats that have very severe gastrointestinal illness. And by the time they get to us, typically they've seen 1, 2, or maybe even 3 veterinarians before they're then actually referred to us, because we work on a referral basis. And so a lot of times they come in very advanced in their gastrointestinal disease. And sometimes we can help them. And sometimes we can't. And when we can't, we worry that it's because the disease has gotten so bad and it's gone so far that even, a therapy that would have worked years ago doesn't work now. And so Dr. Grady and I were very interested in trying to determine, well, how can we help these animals? And we discovered that in people, there's something called preclinical inflammatory bowel disease, which essentially means that a person is at risk for IBD. They start to develop changes within their gut that are supportive of inflammatory bowel disease, but they're not clinical. And sometimes that can happen for months to years before they actually develop clinical signs. And so we, based on some studies that have been previously done, felt like this was probably the case for dogs and cats too. And we started to do some investigations specifically in a breed called the soft-coated wheaten terrier, and determined that that was true, that they do develop this preclinical, what we call enteropathy in dogs. And so now our next study, the study that we're here to talk about today, is trying to figure out how we can help these dogs through diet. Grady, you have anything to add to that?
No, I think just emphasizing that, like in humans, they've been able to find a lot of kind of like markers and suggestions that there's a lot of functional and inflammatory changes going on in the gut even before anyone has clinical signs. And so it seems like dogs have that too, particularly it's been mainly just studied in this breed, soft-coated wheaten terriers. So I think the key is like, well, what can you do about that to prevent that from becoming, clinical disease?
Well, let's talk about background a little bit. I mean, how do you find these pets if they're sort of preclinical? How do they get presented? What do you do to find them?
Yeah, that's a really good question. So in human preclinical IBD, a lot of their sort of initial research was looking at first degree relatives. So people who were related to individuals with Crohn's disease or ulcerative colitis. And a lot of the initial work sort of like in this field was looking at these people who are related to people, with inflammatory bowel disease, but aren't sick yet. And this was really like the population where they started finding all of these kind of concerning early changes. So in dogs, where it'd be great to kind of look at, related dogs. We don't always have that luxury. And so really, I think right now, kind of from a research perspective, we know that there are a lot of breeds who are predisposed to GI disease. It's just something that, there's studies to support it. I think as veterinarians, we're all sort of like, we all have ingrained these breeds that we just know constantly come in for GI issues. And so part of, I think, in the sort of initial research perspective is looking very specifically at these breeds that we know are predisposed to GI disease. But you sort of kind of hit on a critical point that at some point in the future, it would be amazing to use these markers to find it, in other dogs, or, in dogs who you think, maybe have GI disease, but you're not sure.
Has anyone done like a genome-wide association study to look at those responses with the genetic changes? If there's breed, it must be genetic, right? Or tell me about that.
Yeah, so very preliminary investigations, and Wheatons are one of those dogs that have been investigated. And what they found is that Wheatons actually have a predisposition for a disease called protein-losing enteropathy. They also have a predisposition for a disease called protein-losing nephropathy, where they actually have kidney disease. And so there are genetic markers, or at least one genetic marker for the Wheaton that indicates an increased risk for that nephropathy, that kidney disease, but not yet for enteropathy. And that is something we are actually collecting blood on the dogs for the study that we're mentioning, in which we're hoping to find some genetics that are able to show, okay, you have an increased risk, and we're collecting all these samples as well along the way of this study, so that we could potentially say, okay, in this dog, in this Wheaton, we identified, it's got some markers of inflammation in its gut, it's losing fat in its gut, and we also found this gene that told us that would be the case. I would highlight also an investigator out of Michigan State University. Her name is Dr. Sarah Jablonski, and she is doing some of the stuff that you're talking about with looking at genetics and trying to find which dogs have an increased risk for that disease, protein-losing enteropathy, which dogs are there markers, genetic markers that would suggest or support that the dogs might respond to diet or might not respond to diet. So that will be really interesting as well.
Well, shall we talk about the study? It sounds pretty exciting, and I know you guys are really excited about it. Tell me what you're doing.
Yeah. So as Dr. Tolbert mentioned, she previously did this very cool study looking at soft-coated Wheaten Terriers and these markers for preclinical enteropathy, or sort of similar to IBD in humans, and found that there were many changes in sort of healthy soft-coated Wheaten dogs that made them kind of look more similar to sick dogs with PLE. So that's protein-losing enteropathy, which Dr. Tolbert mentioned before. So found all these changes in these healthy dogs, suggesting that, there's maybe some preclinical disease going on. And then as we talked about, sort of the follow-up question to that is, well, what do you do about that? And can you do anything, early to slow or even prevent progression of disease? And so our study is really looking at using diet to potentially study if it has an effect on these preclinical changes. And so we're currently recruiting soft-coated Wheaten Terriers. And basically what they do is they come in, they meet us, we have a great time, we get a bunch of samples, so blood, feces, urine. They also have what's called, they're administered a video capsule for video capsule endoscopy, which is a very cool pill. It's like very small, that you can essentially kind of feed them like a treat. And it takes pictures of their whole GI tract without sedation or anesthesia. So it's a really cool way to basically get like an endoscopy.
How good are those? That sounds like a fantastic. Do we look at, we no longer need colonoscopies now? That's what I want to know.
The bummer is that they don't always get great images of the colon, I will say. But it's awesome for, research purposes in particular and clinical purposes too, I should say. But it's great for especially looking at like the stomach and the small intestine. And again, you don't need to sedate them. You don't need to anesthetize them. So it's an awesome way to look for like lacteal dilation, which can be really common in these dogs. It's a really great way to look for erosions, bleeding. And so all of these dogs just kind of baseline get these really great, awesome diagnostics. And then finally, they also get some additional GI testing. So vitamins, that sort of thing.
Are you looking at microbiota in the GI?
Yes. Yep. So we definitely get lots of stool on these guys that will eventually look at the microbiome too. So once they're kind of cleared, everything looks okay, just, systemically healthy. Again, these are just healthy, soft-coated wean terriers, no GI disease. They get enrolled in the study.
Do you enroll then all of them? They don't have to have any side of, wow, I did this imaging and now I think this is really a preclinical one. They're on the study, or just, hey, I know this is a preclinical one, but I'm putting them all. Which do they all go into studies?
Yeah, that's a really good question we've been dealing with kind of ongoing because we really want, I think from a clinical perspective, we really want dogs who, owners wouldn't even suspect that they'd have GI disease. So no vomiting, no diarrhea. We have kind of strict criteria and a questionnaire to assess that. So we want the dogs that you have no idea. And I think that originally, the thought was like, well, we also want them to be pretty, especially in terms of some of like the vitamin testing, for example, we were expecting them to be, normal because they're normal dogs. And as we've started recruiting more dogs, we've sort of discovered that there are some already markers that are abnormal, in some of this additional testing that we're doing.
Can you tell me what those are? That's pretty exciting.
Yeah. So right now it's mainly just like their B vitamins.
All of them are low. So you'd suggest that it's already keeping them from absorbing those vitamins, and so they're low circulating is what you're looking at, I assume.
Yeah. So this is blood. And a lot of the dogs, surprisingly, just like they seem normal.
Or not surprising, right? I mean, that's kind of what we suspected, is that these dogs are walking around. The owners have no idea that they're sick, but they are sick. And when we look at these biomarkers for disease, we find that they're abnormal. So we are doing B vitamins. We're doing fecal fatty acids, fecal sterols, fecal bile acids, measures of inflammation. So C-reactive protein, for example, fecal calprotectin. So they are getting a variety of different things. And one of the reasons why we're doing that is because this disease is probably not homogeneous. So meaning some of these guys probably have alteration to their microbiota, as you've already kind of alluded to. Some of them probably have inflammation. Some of them have a change in their intestinal permeability. Some of them have a change in their mucus expression in their intestinal lining, for example. And so what we need to do is develop, ideally, a panel of things to actually look for the presence of disease. So one of the ways that I'm hoping this study benefits not just weans, but any dog at risk for this disease, is that we develop an idea about what that panel should look like. But then also, as Kylie has mentioned, we see if they benefit from diet. And the reason why we look at diet is because as we were thinking about this, like what is a benign intervention that potentially could be positive? And the diet is the most obvious one, where it's a benign intervention that potentially has really far-reaching effects. One of the things that I did want to highlight, because, one of the interesting things that you do when you have this world of social media and attention, which is really great because it helps us recruit dogs, but sometimes you get negative publicity. And one of the things that people have been sort of unhappy about is the fact that we chose to do this study using dry diets. And so I would love to take the opportunity to explain why we're using dry diets.
Why do you use dry diets?
It's a good question. Why not use fresh diets? Why not use, like home cooked diet, for example, right? Why not use fruits and veggies in the diets or whatever? the reason why we want to start with dry diets is because we know through the Dog Aging Project research that 90% of dogs in the US are fed dry diets, 90%. And that's for a variety of reasons. Dry diets tend to be easier, they're more portable, they're cheaper, they provide more calories with less. They allow for people to go to work and still be able to feed their dogs and cats a good, complete, and balanced diet. So there are many reasons why dry diets are used by people in the US. And so we want to make sure that our first study that we're doing has implications for every dog in the US, or potentially like the majority of dogs.
At least 90%.
At least 90%. And then we may learn something, right? So like we may learn that, okay, we're looking at 3 different diets. One's a maintenance diet, one's a low-fat diet, one's a hydrolyzed low-fat diet. And we might learn that none of those diets work. Or we might learn that, yeah, the diet has to be low in fat. And then we can take those principles into a next study and we can look at things like a fresh food diet. And we can say, okay, well, now we know that it needs to be low in fat. What if you compare a low fat dry diet to a low fat fresh diet? Is the low fat fresh diet better? So it's not that we're only doing this study. This study is sort of the stepping stone to many other studies that we hope to do.
Well, thank you for that. That seems like a really good explanation. And if I could just put in a plug for those people who want the fresh diet, I think they should fund your research. This will be a very great.
I like the way you're thinking.
So clearly, this can be done. This can be done. You know, I'm interested as you walk through this, you sort of said, okay, here's the stuff we're doing to isolate the pets and understand the pets as we put them on the study. How long is the study and what are you doing to evaluate the progress or lack thereof as the study continues?
Yeah, so it's a 90-day study. So once they get cleared, they get randomized. It's blinded to the owners. It's blinded to us. They get randomized to one of these 3 diets. And then they come in about every month for 3 additional visits. So it's 90 days, as I mentioned. And during that whole time, so they get physical exams, they get routine blood work, just so that we can keep an eye on everything. And then by the end of that 90-day period, we sort of redo that whole, battery of tests. So, they get their vitamins retested. They get another video capsule endoscopy, actually. And then also throughout this time, we're also having them bring urine and feces too, so that we can continue to assess those throughout the diet trial as well.
What are you asking the owners at home about their pets?
Yeah. So originally, the biggest thing is, figuring out, again, that these seem like they're healthy dogs. Do the owners think that they're healthy? So there's a lot of sort of pre-work in terms of seeing what GI signs these dogs have, making sure that they're healthy. And then I think there's also a lot of, comments and discussions about what diets they're on. And I think it's been, at least for me, a very cool opportunity to, talk to owners about their diets. And, just as Dr. Tolbert was talking about why so many people are on dry diets, talking to them about, well, here's why we're going to, try a dry diet first for your dog. So there's also just a lot of discussions about diets that I think are helpful. And I think a lot of owners have really benefited from that too. We've already had one owner who, again, we don't know what food that they're on. The owner doesn't know, but she's already noticed a difference in her dog that she thought was, previously healthy. So it sparked, I think, a lot of good conversations about what we do and don't know, and the benefits of different diets and that sort of thing.
One of the things, as you speak of it, I expect the foods they're eating now may be better than just the random food they were on beforehand. So it's great that you have a control and, you have an internal study. So you're not just looking at, did they change over time? Because even masked as you've spoken, they made changes because you made a better food than the one they were buying before. So
yeah, that's right. Yeah, it was really important for us to include, as you say, a maintenance diet for that reason, so that if they improve on the maintenance diet, then we know it was actually just about a diet change period. But the other thing that we wanted to be careful about is that, we're being really strict with the study, so they can only be fed the certain food, and then we have a very specific treat list. So it will be interesting because one of the things that I've noticed as a nutritionist is many times people are feeding actually a really excellent diet for their dogs, but they're giving a lot of treats. And so the proportion with which the dog is receiving calories from an unbalanced meal is quite high. So it's right that we might actually just see a benefit because of the strict diet trial, not necessarily about the type of diet.
Well, and change is hard. So you've got a sort of negative bump associated with, but they were liking what they're eating now or then, and now maybe not quite so much. So there's lots of benefits to having a randomized and completely balanced, controlled food. Well, what do you think? I mean, where does it go from here? How do you bring this forward? And I mean, just what you said, as a nutritionist, I'm in the back of my mind, I'm sure it's to you too. You're saying, well, now I know this about what, they need more vitamins. Maybe the other things are coming to mind. That next study just seems to run at you even before you're done. But how does it go forward?
Yeah, it's a great question, because actually after we did our first study, I was telling people your dog is not healthy. And they were like, well, what do I do about it? And the answer was, I don't know. And I still don't know the answer. And that's why this study was an important next step to try to figure out, can we give people some advice and doing some of these things that I think might help? Will it actually help? I would say right now, the big thing is make sure your dog is eating a complete and balanced diet that is appropriate for its current life stage, whether it's a growing pup or it's an adult dog or pregnant or lactating dog. That would be the big thing. Make sure that the calories that they're ingesting are from treats are less than 10% of the total caloric intake. Make sure they're getting good exercise. I mean, those are the things, it's just like us with people, healthy. I would love to eat my son's mac and cheese every single night, but I know it's not good for me. And similarly, giving my dog a bully stick every single night or giving it, a bunch of, delicious bacon chew treats is yummy, but not the best thing for my dog.
Not complete and balanced, right?
It's not complete and balanced. So that's what we can say for sure. But we have some interest in doing other studies as well. So for the people who are not interested in doing a study in which we're feeding a dry diet, Kylie is very interested in looking at some oxidant injury that happens in dogs and intestinal disease. And so that might be something that we're looking for patients for. And the other thing I'll say is we're still looking for patients for this study. So we're still looking for healthy wheat ends. And we're enrolling particularly at Michigan State, at Texas A&M, and at North Carolina State. But we might be opening up to a location in Pennsylvania as well as Wisconsin. So we will keep you posted on that.
Well, if someone wanted, let's do this sort of deep dive on that section. I have some more questions about your study. But if someone said, wow, I've seen this, I'm interested in this, and I have that type of pet, how would they contact you to ask about, maybe they're in the area or maybe whatever's needed to be enrolled? What would they do?
Yeah, so we can probably, we're happy to share contact information too, and even just chat about people's pets, see if they qualify. You can also go to Texas A&M has a clinical studies page that has all of our information, a great questionnaire. So definitely people are welcome to go there. It's also posted on Michigan State too. With Dr. Jablonski. So those are two great websites that you can get more additional information and then also have our contact information too.
Okay, thank you. Well, I think you might find some patients through that. That would be a great outcome. Tell me about you. One of the things you mentioned that I'm interested in was the fatty acid. I assume this is fecal fatty acids. And, we often think of short chain fatty acids or branch chain fatty acids or those sorts of analytes. But what are you looking at, and why do you think it's important in this study?
Yeah, I do have interest actually in looking at short chain fatty acids and branch chain fatty acids in these dogs. We haven't done that to date, but that is something that I'm very interested in. We've been looking at more of the long chain fatty acids, particularly what we find in dogs that have chronic GI diseases is that they, for whatever reason, tend to lose a fatty acid called nervonic acid. And nervonic acid is really important for things like the myelin sheath, for example. And so when they have intestinal disease, they lose a lot of nervonic acid in their feces. And interestingly, we found that the healthy wheatens also had increased loss of nervonic acid in their feces. So that is one particular one that we're really interested in seeing if in the second study, do we see that again, which would be really telling if we do. And if we do we make it better with some of these diets, or should we give them nervonic acid as a supplement? Now, I don't recommend that right yet, but that would be something that would be very interesting in us studying as well.
So I'm not, and I feel like I know a lot about fatty acids, and I've heard of that fatty acid, but tell us a little more about it. Assume it's polyunsaturated. How many carbons is it, and what's
wow. You're going to make me have to Google a little bit because I can't remember. I think it's 19 carbons, but
it's okay. But it's not common in foodstuffs, right? I mean, in all my analysis, I'm sure it's there, but it's not looking like EPA, DHA, linolenic.
Yeah, no, and I don't think it's one that's really highly prevalent in foods, unless I suppose you were eating a lot of animal tissue that had like nervous tissue, for example. So thankfully, like, we won't be interfered by with necessarily nervonic acid coming from the diet and different levels of nervonic acid in these different diets. So that's nice. But yeah, it really tells us for sure, like if it's coming from the intestine, then what we know is that there's pretty severe intestinal damage ongoing. Because if you get down to where we have nerves in our intestine, I mean, obviously we have the enteric nervous system, but you're talking about a real disruption of the villus epithelium, some of the lamina propria, for example. So it really does indicate that there might be more severe damage ongoing.
And unlike some of the fatty acids we look at, it's neither a postbiotic or a member of the membranes. This is
exactly
truly pet origin and
truly coming from the host.
Yeah,
exactly.
And you don't want any, right? I mean, really low is really good. I assume this is
exactly.
Yeah,
that's right.
Well, what other things? I'm sort of interested, are you doing like metabolomics to get this large scale, here's all the metabolome floating around, or do you have a more focused, I'm interested in this blood factor that's going to be telling, hopefully?
Yeah, I mean, we are doing a lot of the same things that we did before, just one, to see, is it repeatable at baseline? And then two, to see if some of the things that we saw that were altered in these dogs improves with diet. But we are collecting, for example, urine and blood. And as I mentioned, one of the things that we're interested in doing that we didn't do in the last study is looking for the effect of, oxidative stress, for example, oxidant injury. And again, looking to see, does diet help these dogs? Yes or no? So we have collected blood for metabolomics, and probably will do maybe an untargeted evaluation to start, and then maybe a little bit more targeted once we have a better idea of what things might be altered. But we don't have anything particularly planned yet for that.
So you talked a little bit about the inflammation markers, both circulating and in the fecal samples. But I don't know if we've talked so much about the oxidative markers. Are you going to be looking at things like superoxide dismutase or markers of oxidation in the blood, or what markers are you using there?
We'll probably end up looking at a couple of different markers. It's important to be trying to find, assays that are validated, especially in dogs. There are a lot of assays out there that, like our commercial tests that have been used in human studies, and not necessarily looked at in dogs. And we obviously want to make sure that, that we're measuring what we think we are here. So we'll probably be kind of doing a combination of some blood oxidative stress markers. There are a couple, there's plenty of studies that have looked at things like superoxide dismutase and those sort of markers. I think it's just kind of, figuring out exactly which ones that we want, and that will be, good markers around.
There are a lot of good markers. Glutathione, that whole thing, just looking at, you said the vitamin Bs were down. Was vitamin E down as well in these pets that you think might be preclinical?
Vitamin E is tricky in pets in terms of measuring it and understanding what it means. The assays are quite, they don't always capture everything that they want. And there have been some studies looking at vitamin E concentration specifically in dogs with protein-losing enteropathy, and they're kind of all over the map a little bit. So we don't have plans to look at vitamin E. Vitamin D might be one that we decide to have a look at. But Kylie's being a little cagey about some of the things that she's interested in looking at. I think because we actually are submitting a grant, an internal grant to Texas A&M to look at a specific measure of lipid peroxidation in these dogs through urine. So we're definitely going to have a look at that if Texas A&M will fund it, because it wasn't part of our original grant. So we're hoping to do some of the things that you mentioned, but we're being cagey because we don't have funding. We don't have funding to do it quite yet.
Well, best of luck. And if you're looking at thromboxane there sometime, you can send me the results, because that's
absolutely.
It's time for our famous three.
Tired of navigating the pet food industry alone? The Pet Food Inner Circle brings together the brightest minds in pet nutrition, where seasoned professionals share real insights and tackle the challenges that matter most. When you need answers, industry leaders are just a conversation away. Ready to join the circle? Visit petfoodinnercircle.com and connect with your peers today.
Well, tell me, if you look forward in this, we've kind of used our time. It's been so interesting. Thanks for telling me about this. But I have two questions I'd love to ask. One is the general question, maybe the last question about this study. As you look forward, what would you like to see? What would be, the home run if this happened? That would be great.
I always say this, and I try not to get emotional when I talk about it, but I think that, our jobs are really hard. And we see a lot of dogs and cats die from GI diseases despite our best efforts. And it's really, it takes a big toll out of us. And obviously, of course, it takes a big toll out of the pet parent. So I'm not trying to minimize that, but over time it is difficult and it is draining, and you spend a lot of nights in bed thinking, what if? So I think for me, if we can save one dog with this study, I will consider it to be a win. I can think of all the dogs that I've lost and the names of those dogs, and it is difficult. And so if I could come back and save one dog, Melon, Einstein, any of them, it would make my life better. And I know Kylie feels similarly, because I've seen her go through, as a resident underneath me, I saw her go through, similar really challenging patients. And I know it took a toll out of her too. So I think if we can save anybody, we will consider it a success. Kylie, what do you think?
No, I don't think I could say it any better. I agree.
Yeah, it's fascinating. I really see your medical, understanding and compassion for the pets in that. That makes sense to me, of course. Shifting gears a little bit, I always like to ask people, I hope you would think about it with me a little bit. You have described a very significant team of people working together and hopefully productively enjoying each other's time. What do you think is necessary, or would you value in an individual who you might consider joining a team or leading the team? What do you look for?
That's a great question. I have a motto for myself, is surround yourself with people that you think are better than you. It's the reason I have the graduate students that I have. It's the reason that I have the veterinary nurse that I have. It's the reason that I'm a part of the GI lab, because they all bring so much to the table. They work very hard. They're selfless. They lack ego. They want to work as a team. They want to make things better for the individual in front of them and for the patient in front of them. And so that's what I would say in terms of what I'm looking for. How do you make us better?
Yeah. What do you think, Dr. Grady?
Yeah, I totally agree. And I think it's been just really fun and cool to see, especially, people's interests and passion for this topic too. So I think also sharing that same passion, having those same experiences with those really difficult cases, it makes it really exciting, makes it really fun. And in addition to all the benefits that Dr. Tolbert already mentioned, I think people coming at it also from different perspectives, different backgrounds, gives us so many more ideas of what to do next and how to troubleshoot. So also just having people from, all these diverse backgrounds, diverse interests, I think is just fantastic and makes the project stronger, and makes us stronger too.
Well, thank you. Well, I feel like we've been able to understand a little bit more about what you're doing, and certainly it's a fascinating project. I'll look forward to hearing your results. Let's try and plan. Well, I should ask. Okay, complete sense. Let's try and plan a discussion maybe after your peer-reviewed journal article comes out. Get another chance to kind of review and tell us what you found. It's going to be exciting. But for now, let's call it a day. Do you have anything else you want to add? Something I didn't ask?
No, we just appreciate your time, and we appreciate the opportunity to talk to you about what we're doing, and we appreciate the listeners who are taking the time to listen to what we're doing, and we hope that we'll have something beneficial to share.
Thank you. Well, Dr. Tolbert, Dr. Grady, thank you again. Let's sign off.